Yes, it is morning here down in South Florida, and we are here at the Hanley Center, Hanley Foundation, talking about a little bit different situation than a hospital or a well, they are healthcare provider, but a hospital CEO. I'm here with the CEO of the foundation, Rachel.
Good morning. I am Dr. Rachel Docekal. I'm the CEO of Hanley Foundation.
And tell us how long you've been with the foundation, Rachel.
This is actually my second time around. I served as the CEO of the foundation from 2010 through 2014, and then I founded a consulting firm called the Lyra Group. But my first client and longest client was Hanley Foundation. They asked me to come back in February as the chief executive, and I was delighted to retake the role.
Well, probably, as we'll get into it later on, they probably had some other motives to bring you back. So, but we'll get to that a little bit later on. So tell us, the viewers like to know when they watch these from a leadership standpoint, from professional leadership in healthcare. Tell us a little bit about your family.
Sure. I have an amazing husband. He is a director with the Healthcare District of Palm Beach County. So both of us are really focused on community-based healthcare. He works for Traumahawk, which is their helicopter life flight. And then I have two daughters who, they are amazing. I know I'm a mom, but they are really, truly amazing. One is about to graduate from Florida State, and the other one is a freshman at a liberal arts college in Pennsylvania.
Oh, nice. Very, very nice. And your education background, because we like people who are looking at this say, well, one day I want to take Rachel's job. So what do I need to do in order to do that? So what is your educational background?
Well, I started at the same school that my daughter's at, Chatham University. And when I got out of school, I wasn't sure what I wanted to do. So I took a couple of gap years, and then I went back and got my MBA with a concentration in marketing from the University of Pittsburgh. I had the honor of working for then Chancellor Dennis O'Connor while I was there. So I worked and went to school at night. Took me a couple of years, but I was able to earn my MBA. At that point, I met my husband and came to South Florida. And I ended up at Nova Southeastern University working for the early child development school there, which at the time was called the Mailman Siegel Institute. And while I was working for NSU, I earned my doctorate in organizational leadership.
Oh, very nice. Which is useful. There are some doctorates, I believe, that are non-useful, where that one I think is very, very useful, especially in today's world.
It really is. It really is. NSU's program was tremendous, and I was very, very fortunate to be able to get both of those higher degrees without any student loans because I was working there at the time.
Always good benefits at school. Always good benefits.
Yes.
So, we kind of talked about in and out about your career, so I'm going to jump to another question.
Sure.
During your journey through the workforce, what were some of the major challenges you ran into each time, or that kind of helped you and maybe hurt you somewhat as you progressed?
Really good question. I am a big believer that we learn through challenges, and I can say that some of the most difficult situations that I've encountered in my career were times when I learned the most. I think that as a young person, I really needed to understand how the corporate world worked. It's really easy when you're in school and you're getting your MBA or you're getting your doctorate, and things are supposed to be a certain way based on what textbooks say. Well, there are a lot of complexities in each and every workplace, and probably the most valuable lessons that I ever got were just learning to work with others, learning to listen, understand what they were saying, lean in to adversity. I mean, the easiest thing to do when faced with adversity is to want to walk away or to have a bad attitude. But I learned early that if you really lean into it, at the end of the day, you're going to end up learning something that you never thought possible.
Yeah, absolutely. And you also find the early careerists or students always ask the question, they get down on their hands and knees and they beg you because they're looking for a mentor.
Yeah.
And they're looking for a mentor to be able to help them navigate the landscape of healthcare. And there are so many different facets of healthcare. We'll get into that with you, but later on.
Sure.
Little facets of healthcare. Who were your mentors during your journey to where you are today?
First of all, let me say that I've had countless mentors. If I had to maybe pick three, I would pick my late professor from when I was getting my MBA. He was my accounting professor, but he really taught me a lot about spirituality and life and the complexities that come with business. My second mentor probably was Dr. Wendy Macy. She was the dean of the Mailman Siegel Institute and probably the most tremendous leader who I've ever had the ability to learn from. Wendy is such an incredible person and led with not only a mind that was tremendous, but also with her heart. And I would say the third one is my current board chair, Charles James. He is funny, he's insightful, he really cares about Hanley Foundation and helps us to move forward in a way that is always positive and constructive.
That's great. There are, because the mentor and I chuckled a little bit when you mentioned your accounting professor, because I'm actually a CPA. I kind of hide behind that, but I'm actually a CPA. So I chuckle when it's like an accounting person is a mentor. So tell me one piece of advice you would give to an early careerist that is looking to get into the field of healthcare from the foundation standpoint, because obviously that is your strength, the foundation, managing foundations.
Sure.
And actually foundations that actually not only are a foundation, but actually have, as we'll go a little bit later, actually serve the public, not necessarily just a giving foundation, but you have services and products to give out.
Sure.
So what kind of advice would you give to that person?
To play off of what you said earlier, if this is somebody who was looking one day to step into my role, I think what I would tell them is that in order to create an environment where your staff are able to give the best possible care, not only best practice, but best practice and beyond. You have to create an environment where your staff are in the best place they could ever work. So for them to be able to go outside of themselves, we need to make sure that it's the best place to work. They're comfortable, they feel empowered, secure, good benefits, all of those things.
So not only managing the foundation, but managing your most important assets, which would be your people.
That's right. That's exactly right.
So we'll go through, those are our standard questions that we usually go into with any CEO. Now we're going to do a deep dive into the Hanley Foundation, which I think is a very, very interesting story, especially in just sort of recent news that came out. So give us a little background on the Hanley Foundation, if you would.
Well, the Hanley Foundation was founded in 1984 by Jack and Mary Jane Hanley. You can actually see a painting of them right over my shoulder. Mary Jane Hanley is still with us. She's 96 years old and a force to be reckoned with. She also is an alcoholic. And when she realized that she was struggling with the disease of addiction, she got quality treatment, But then when she came back to her family here in Florida, she and her husband Jack realized there were no quality treatment centers here in Florida, and they decided that they were going to create one. They raised the money, and what became the Hanley Center, the sister organization to Hanley Foundation, was opened in 1986. So for about 40 years now, Hanley Center has been leading the way with quality treatment, innovation, best of the best care, and it's all set on 13 acres of botanical garden right here in Palm Beach County.
Yeah. And it has a wonderful center. If you haven't been there, it's also a place to visit, to be able to go see what it's all about.
Well, we have a building right on 45th
Right.
Street
Mm-hmm.
that is...
Been there a couple of times.
Yep, that is where we welcome members of the community for meetings, for just different events, educational events. So anybody who would like to join us there certainly is always welcome.
Yeah, you have a wonderful auditorium there.
Mm-hmm.
It's a great auditorium. Been there a couple of times, had different events there.
Mm-hmm.
So with that, just recently, it looks like you, and I mentioned it earlier, actually David got the Goliath on this one, and you really kind of not only increased what you're doing, but tripled basically your mission out there, or dealing with people. So tell us what transpired. I'll need to know the whole transaction, but
Sure.
What was the thinking behind doing that, and you're staffed up to be able to make that happen or carry it forward?
This was an amazing story and opportunity for the foundation. Back in 2014, let me say that the foundation's sister organization, Hanley Center, by a really challenging turn of events, became a for-profit and part of a larger treatment organization called Origins Behavioral Healthcare. The foundation continued in its mission, and we are actually the largest provider of prevention services in the state of Florida. So the foundation has led the way with advocacy work, with education work, with prevention, as I mentioned. But what we weren't doing was direct treatment. We were giving scholarships for treatment, but we weren't doing treatment ourselves. When I retook over the helm this past February, I jumped on a plane with my board chair and we flew out to Dallas, and that is where Origins was headquartered. I had an opportunity to visit with the former CEO of Origins, an individual named Jim Caldwell, who I just can't say enough good things about. And during that conversation, I had the opportunity to say to Mr. Caldwell, if you ever want to sell Hanley Center, please call me. Well, he called the next morning. Took us a number of months, but we just closed the acquisition this past Friday. So Hanley Foundation has gone from an organization with a budget of about $12 million to an organization with a budget of about $45 million, basically overnight.
Wow.
Overnight.
And you obviously have the people to handle that. Oh, we'll get the people to handle all of that.
We weren't doing treatment. So
Right.
This has been a tremendous opportunity to bring the whole organization, including the people who have been doing amazing work, right into the fold and part of the foundation.
Well, that's great. That's great. So now so the Hanley Center now is now part of the Hanley Foundation.
It is.
Whereas before it was actually the Hanley Center, but it was not part of the foundation. The foundation
That's right.
supported part of it, but was not part of it.
That's exactly right. That's exactly
So
right.
does the Hanley Center now fall under a nonprofit status?
It does.
Ah,
It
very-
does. So this large organization with sites in Dallas, on South Padre Island, as well as here in Florida, it's all not-for-profit.
So how many locations do you have now?
Well, we have Dallas, South Padre, and Florida.
Really?
Mm-hmm.
Oh, okay.
Mm-hmm.
So that'll keep you traveling.
I'm going to get my mileage up.
So are you the CEO of the foundation and these other?
I am.
Nice.
I am. So we have executive directors in each location. We have a tremendous leadership team. It's 15 people, and it is just the best of the best. I can't say enough about my team. Truly, it is this team that made this acquisition possible.
Well, that's great. That's great. So tell us what the new Hanley Center, as opposed to the old Hanley Center, not sure the old Hanley Center, and the types of services that you offer to the community, and how people, now that it's a nonprofit, does the service model change somewhat than from the profit standpoint of having to serve a certain part of the population? I know it's a trick question. So.
So first of all, let me say that we primarily treat a population that we refer to as the ALICE population. So asset limited, income constrained, but employed. Mm-hmm. So think of that family that maybe has a couple of kids, maybe a house, maybe a car payment. But if they had to pay a large deductible for treatment, for addiction treatment, it might be challenging. That is our population. Mm-hmm. And, what we can do as a not-for-profit is we can use our scholarship dollars to help those folks who have insurance, maybe with the deductible or the out-of-pocket that they need to contribute to a treatment stay. We have 107 beds, and within that number of beds, we have a number of different programs. We founded and are the leading provider of addiction treatment for older adults, really in the world. Our program is second to none. We have a very, very robust medical department, and we look at mind, body, spirit, and not only help these older adults with addiction, but we help them get their physical bodies back and healthy as well. Certainly we treat men, we treat women, but we also have a first responders program, and we work with veterans. We are about to start. Now, one of the great things about being a not-for-profit is we can ask donors to help us when we want to start a new program. So here in Florida, there are very, very few resources for pregnant women who are addicted. One of the programs that we're going to start right away is working with pregnant women, and that's going to be a program that's going to work with them not only through their pregnancy, but we're going to make sure that after they give birth, we help them with education and job training and making sure that they are stable and situated before they exit our program.
I noticed that the center is actually located right next to the St. Mary's, what I would call complex.
Yep, that's right.
Which has not only the hospital, but a variety of buildings, has a Palin Institute, has a variety of different institutes.
Amazing hospital.
Yeah, amazing hospital, and amazing as what I would call, not even got the hospital, but you're there, the Palin Institute is there, both nationally world-recognized organizations.
Yes.
Do you interface with the hospital much as far as dealing with their Baker Act patients and that kind of stuff?
We have first of all, I can't say enough about St. Mary's. They are a tremendous, tremendous resource for us. Sometimes patients admit and their acuity level is just too high. When that happens, we partner with St. Mary's, and those individuals go over to St. Mary's for a period of time. In terms of a Marchman Act or a Baker Act, one of the things that people don't know about Hanley is we have 8 mental health beds, amazing mental health beds. So we can take those Baker Act patients. And then the Marchman Act certainly is that 30 days of addiction treatment. So that's pretty common.
Right.
But strong partnership with St. Mary's, and we are very grateful to them for everything they do.
Okay. So where do you see, now that you've tripled in size overnight, obviously you never want to stop. So what are your next steps? Where do you see the foundation? Obviously it was a big boost to where you are today to this past week. Where do you see yourselves in 5 years? No secrets, just where do you see yourself in 5 years?
Oh, that may be a question better answered by
our
board of directors. Yes. What I can say is that we have a 5-year strategic plan for the work that we're doing in prevention and advocacy and the like. We are developing a similar plan right now for the new treatment side of our business. And no spoilers, but the Women and Children's program, that's a big part of it.
Sure.
Expanding our first responder program, that's part of it. Expanding the work that we are doing with veterans, that's part of it. And then one that I forgot to mention earlier is we actually have a dedicated professionals program. So individuals who rely on licensure for their living. So think air traffic controllers, doctors, nurses, lawyers. We plan to expand that program as well. That can be really a challenging situation for those folks. They don't want to raise their hand and talk about needing help, but it's so critical that they do. And so, we wrap that program in confidentiality and everything that they need to ensure their recovery.
Do you see, and only from not my personal experiences, but personal experiences of people that I know, that the older population, and I'm an older population person, but the older population recognizing that people that thought that drinking was socialized and it really wasn't a problem, that even at the age of the late 60s and 70s, all of a sudden find themselves, didn't realize it before, that they really have a major problem, okay? Are those people that you look for to be able to help at that age?
Those are the people we help every day. We have people in their 80s who are in our older adult program. Typically what will happen is it's a child or maybe a caregiver who recognizes that the individual has an issue. Many times addiction is mistaken for dementia. It takes quite a while for the brains of an older adult to clear. Most older adults are with us for 60 or 90 days. And as I spoke about earlier, we work on their bodies. These are people who maybe weren't able to walk, or if they were walking, were using some sort of wheelchair or walker. We truly bring them back to health, and we give the family their loved one back.
That's great. Well, with that, we will follow up with you probably in another year.
I can't wait.
I like your location and talk about what you've done, so I can get into that one more year into that 5-year program as the secrets begin to unravel. But I just want to thank you here. And I guess there was one more question that I always ask everybody at the end.
Okay.
And usually hospital CEOs have this major problem. Not major problem, but, because of the moving parts within a hospital.
Sure.
But you're getting into that right now. I mean, before it was just a foundation, but you're getting into dealing with a lot more clinical before. So you may not have it now, but what do you think is going to keep you up at night thinking about the different locations you have, your different people that you serve? How do you How do you handle that? How do you kind of relax at night? How do you, what keeps you up?
One of the things that we talk about is our relentless pursuit of perfection. I would say that that's what keeps me up at night is how do we make patient care better? How do we get our message out? How do we make sure that we're giving back to the community? How do we ensure that when we have that small window of time when somebody is ready to get addiction treatment before they use again, how do we take advantage of that and make sure that we get them into treatment and respond quickly?
Sure.
So those are the things that today are keeping me up at night. In a year
may be different.
Maybe different.
Well, I want to thank you for the hospitality.
Thank you.
And it was great learning about the center. And we look forward to seeing you at another time.
I can't wait.
Thank you.
Can't wait. Thanks so much.
And this is Charles Felix. Again, another great interview on leadership in healthcare. And we look forward to seeing you at the next interview. Take care. Bye-bye.
Bye, everyone.